Hi, I am making this video to kind of do a quick update of how my radiation simulation went last week and kind of where we are in terms of starting radiation. So last Thursday, today's Tuesday, I had my radiation simulation, like CT, to like prepare me for radiation. So I haven't started radiation yet, but I had like my initial scan and got everything set up so I can start soon. Hopefully I'll be getting a call here soon to get me scheduled for the next 6 weeks. So I'll have treatments 5 days a week for 6 weeks. So at that appointment, I had to like undress from like the waist up and had a gown on, and basically was put on a table that is gonna be like really similar to the machine I'm gonna be in for radiation, for like how I'm gonna be positioned. And so the whole purpose was to kind of like make markings. They created like a mold of my body or of my chest area and practice some breathing techniques. And then also like look at images of my anatomy so they can better, like, I don't know, do all the doctor things they need to do to get everything right for radiation. They need to look at where my heart's at and how much of my heart is going to be in the radiated area, and, you know, make some decisions regarding that. So the whole appointment took maybe an hour. Nothing hurt. I wasn't uncomfortable. I didn't get, you know, pricked with needles or anything like that. I was a little sore when I was done, like just from laying on a table, like a really hard table for that long. Like my neck was really sore, but that was it. But the next morning I was fine. Yeah, so basically, I went to the room, met with my team of doctors. They had me like first lay down, and the first thing they did was like align me with the machine. So there was like some lights coming down I couldn't really see, but they would like try to align me like center line with the lights. And then they made some markings, and so I still have some of the markings I have to keep until I start. So here is one, and it has a clear sticker on it. It's like Sharpie, and then with a clear sticker on it to help protect it. And I have like that goes all the way down, and then like all the way, like even I have like a mark in my armpit as well. There were other markings that came off in the shower, like I had it like all, like I had one right here, like all over, but these are just the ones they need me to keep. And then I'll be getting more permanent markings, I believe, next time I go in. So they had me lay down, and the doctor came and made some markings, and then they made like a mold of my anatomy, like my chest area, using, I don't know, it was some kind of like thick plastic that was pliable. Once they put it in an oven, it was like warm, and then they cut it and they marked it more. So they did that for a while, and when they need me to like move slightly, they would just like shimmy the sheet under me. My arms are like up, both of my arms are like up, and on like an armrest behind me above my head. And with my left arm, since I'm being radiated on the left side, there's like it's kind of like almost like a big blood pressure cuff that like squeezes it, but not as hard as a blood pressure cuff, but it like blows up, and it's just kind of to help me like hold my arm down. Excuse me. So, you know, it's kind of like you're laying there and they're just like doing all these markings and different things, and everyone's really nice and stuff. And then they wanted to take images, so CTs, CAT scan images, and they, like the machine, kind of like any, I don't know, a bone scan, MRI, all of those, it's kind of like the table moves and you go in like a big circular machine. So it's kind of like that. But a different thing with it is, I mentioned this in my last video, but since I am getting radiated on my, sorry, there's a bee. Let's see if it goes away. Since I am getting radiated on my left side, they want to be cautious of my heart. And so a thing that they do is have you like basically hold your breath. And so beforehand, I had known I was going to do this, and they actually sent me videos to watch, and I'm glad I did, because it's kind of overwhelming. I have like this mouthpiece in that kind of feels like a scuba diving thing, you know, that kind of sits like in your teeth and you like bite down on it. And then they put a separate nose clamp so you cannot breathe through your nose. And then also goggles, and inside the goggles are like a computer screen, so I could see like my breathing patterns. I see the same screen that the doctors see on their screen. And so basically they had me like practice. They had me hold my breath as long as I could. I only held it for like 20 seconds. I probably could have held it longer, but I just didn't want to make it uncomfortable or have like I had to hold it that long every time. So I just did about 20 seconds. So I started to feel a little like, okay, I don't want to hold it anymore. And then I just stopped. And like they tell me to breathe normally. So like the mouthpiece is hooked up to like the computer, and I would breathe normally, and I'd see like a blue line go up and down and up and down. And then they say, okay, you see the yellow bar up there, hold your breath and hold it straight in the bar, and then you hold your breath until like she says, you could breathe normal, and then you see the line go down. And so we did that for probably like 20 minutes of like different, I don't know if they're doing their thing. They were telling me different ways to hold my breath and different lengths of time, as they were also, at first it was just practice, but then they're also taking images. And so all of that, all the information they gathered is going to help them set everything up perfectly for when I do start radiation. I'm hoping I start Monday. Today's Tuesday. I'm hoping I start next week. Sooner the better. So all that is going to help them. And though that's why I have to keep these marks, because I'm going to keep these, and then when I start, they'll take them off and they'll make other markings. Sometimes people get little tiny tattoo marks. I don't know what, they didn't really mention what type of marks I was going to be getting, so we'll find out. I'm not worried about it. And then they did tell me like if these accidentally come off or something, because, you know, if you're sweat or like, I've taken plenty of showers and they haven't come off yet. She said if they do, no one's going to be mad at me. It'll just take a little bit longer the first day. So my first radiation, whenever that happens, might take a little bit longer in general because it's my first time. And then after that, it should be pretty quick, you know, in and out. And just getting it scheduled is what we're waiting on. I did get a call a couple days ago, like on the day after, so on Friday, from my doctor, and it scared me for a second, but then like when I thought about it, it makes sense and it's fine. But they scheduled me to go in and get another ultrasound of the lymph nodes in my armpit. And her reasoning was because she just felt like no one ever got a good view of it since my cancer came back. The last ultrasound that they have documented of my armpit lymph nodes is like my first cancer, so like June 2020. And they have no reason to believe that like anything's in there. They are already gonna radiate it, but they just want to like double check and to get a good view. And at first I was like, do they see something, you know? But then I thought like I've had an MRI. I mean, already had a CT scan in February this year and a bone scan, and I've gone through chemotherapy. And so like if anything was like hiding, most likely like the chemotherapy would have killed it, and like my other scans something would have popped up. And so nothing, you know, feels swollen in there or anything like that, but they do still just want to take a look at it. But they said in the meantime they're going to proceed as normal, so my ultrasound is tomorrow. Yeah, so that is kind of it. Hopefully I'll be hearing soon about starting. And then we planned a vacation for when we're all done. We're gonna go to Florida for a week, a couple weeks after I'm all done with radiation. So that's something to look forward to. So thank you again, everyone, for your prayers, and I'll let you know how it goes once I start.